everyone. Welcome to Meeting Midway, Tier 2 Prevention, hosted by the Missouri Department of Mental Health. My name is Carl Hanger, and I will be your chaperone as we walk together through Tier 2 supports. What is it? How does it work? What does it use, and how do we use it? Together, we'll do a deep dive with each episode into this topic to gain greater knowledge about this subject. At the end of each episode, it's hoped that you'll have a greater understanding about Tier 2 supports and see how it relates to your daily lives. And with that, let's move on to the show. Hey everyone, on this episode we're talking with Molly Delaner, Taylor Thomas Harris, and Kayla Diggs Brody about a tool they developed to help make healthcare conversations more accessible and personalized, specifically for individuals with developmental disabilities. The tool is known as CHAT, which stands for Communication and Health Advocate Training. The goal of this tool is to empower individuals with developmental disabilities to take ownership in their own healthcare needs and have a voice in their treatment decisions. You may be wondering how and why CHAT may be connected to Tier 2 based on this information. And the answer lies in that CHAT increases and empowers communication channels between individuals, their staff, and their doctors. As we learned in a previous episode, Beyond the Universal, behaviors might occur due to medical reasons, where individuals may struggle to communicate medical issues or may not feel empowered to communicate such issues. Thus, they may act out due to the pain they feel. By cleaning up these communication pathways, we, in essence, prevent risks down the road by allowing an avenue of communication and empowerment through this tool. And with all that, let's move on to the show. Hey everyone, welcome to this episode. As mentioned in the intro, we have Molly, Kayla, and Taylor on the show. All right, so my very first question is, I believe, for Kayla. Basically, Kayla, can you just describe who you guys are and a little bit more there, please?
Yes. Yeah. Thank you, Carl. Molly and myself work at the Partnership for People with Disabilities, which is housed under the School of Education at Virginia Commonwealth University. And Taylor works with us on different projects that the partnership develops and implements. And what's really interesting is the partnership, as we call ourselves, rather than saying our super long name, is a University Center for Excellence in Developmental Disabilities, or what we more commonly call a UCED. As a UCED, we're a member of a national network of other organizations like us across the U.S. that are usually linked with universities or teaching hospitals across the country. And so through us being a UCED and other institutions as well, we serve as liaisons between academic institutions, so that would be here at VCU or Virginia Commonwealth University, and then service delivery systems. So that could mean Medicaid offices, that could mean vocational rehab offices, that kind of thing. And we serve as a resource to help people with disabilities and their families live better lives. And here at the partnership, our mission is to partner with people with disabilities and others to build communities where all people can live, learn, work, and play together.
So I'm glad we have that background now. I think this one question is directed towards Taylor. Taylor, can you basically describe why do we need CHAT?
Yeah, so we need it because a lot of people with disabilities have health disparities. This is a big concern to people with disabilities because a lot of times we don't get the proper care that we may need. So that is, we don't get the proper care that we need. And then also, people with intellectual and developmental disabilities experience proper treatment as compared to people without disabilities. The primary goal of CHAT for people with intellectual and developmental disabilities to learn how to communicate effectively about their health concerns, their doctors, healthcare providers, and supporters. And in addition to this, people with intellectual and developmental disabilities learn how to take the initiative to speak up and ask detailed questions about their health because as a person with a disability, it's important that we advocate for ourselves because nobody knows us better than ourselves, and sometimes we need help with that. But it is basically just to help us advocate for ourselves better. And then I also wanted to share a little bit from that was sent to me called the spotlight that that mentions a new screening for social determinants of health, which is SDOH for people with IDD. Research shows that people with intellectual and developmental disabilities are at a high risk for health disparities, including a shorter life expectancy and an early onset of age-related conditions. And people with IBD are also more likely to have heart disease and high blood pressure compared to non-disabled people. This is also why that is very important for people with disabilities.
Perfect, Taylor. I'm really appreciative of you being here and explain why we need chat. And just to kind of summarize what you just mentioned here, chat is an approach for better communication between someone with IED and their healthcare providers or the healthcare profession. You mentioned I think it was a newsletter. I think I heard Candor Spotlight or something along those lines. So hopefully we can, was that the correct newsletter, Taylor? I heard Candor or the newsletter. I wrote it down, so.
No, it's called a screening for social determinants of health.
Okay.
The SDOH, is that correct?
Okay. Molly or Kayla, can you put that in the chat for me just so I can kind of put that down maybe? Okay, yeah. But Taylor, you also mentioned that individuals with IDD or some other type of disability studies have indicated that they have a higher risk for things like heart disease and very preventable diagnoses compared to the other population. And hopefully through the use of chat, that can be shifted and turned around a little bit so that it's more of an equal playing field. So I am really appreciative that you mentioned all of that. I think what we really do need to know is the background of chat. And I think this is more directed towards Molly. So Molly, can you kind of give us just a little bit of an understanding of where chat come from, its history and things of that nature?
I'm happy to do that. And Carl, I want to also thank you so much for asking us to talk to you about this. It's something that's really important to all of us, and we love sharing information about it. So like a lot of ideas, this started out as something totally different. We got a grant from our Developmental Disabilities Council, the Virginia Board for People with Disabilities, awarded us money that we worked to develop a project to teach people with disabilities directly about health advocacy and health literacy. And that is speaking up for your health and also understanding why it's important and what your health priorities are and things like that. And we did a really good job, but then the pandemic came and nobody could talk to each other face to face for 3 years. We had people with disabilities and their family members and people from the medical field all involved in an advisory council that gave input onto what was important to be taught. And so we really insist that that is part of our foundation, that people with disabilities and their family members provided input as to what they wanted and what they needed. And it was taught by a person with a disability. Taylor was one of them who did the chat trainings. And so we developed through that a workbook to enable support staff to ask people with disabilities about what they wanted in their healthcare and how they wanted other people to be involved and helpful with them. I am a certified person-centered thinking training, and so I incorporated a lot of the person-centered principles into developing the tools that we use in chat. And so the workbook is really a very step-by-step way to have a conversation with someone in a very open way of saying, what would you like to see at your healthcare appointments? How could I be helpful? How to describe what are your health priorities? If somebody came up to you cold on the street and said, what are your health priorities? You'd go like, I want to be healthy. But what do you want to do? What do you like to do that would be impeded if you didn't have your health? So if it's important to you to hang out with your friends, and which is important to most people, then you're going to need to be able to communicate with them in a way that they understand and be able to listen to them. And so maybe that's part of your health priorities, is establishing healthy relationships and being able to communicate with them. So it's hard to determine those without just kind of peeling the onion and really asking open-ended questions to make those determinations. So that's what we developed with Chad, and that's what we've been sharing.
And I want to mention that I have seen the tool at the most recent APBIS conference that was held in Chicago, and it was a really in-depth tool. And it reminded me of this other conference I went to, American Public Health Association, that was held in Atlanta, Georgia. And the one session was about individuals who are hard of hearing or completely deaf, and they require someone to go into their medical appointments with them, and how the medical profession, the doctors were talking directly to the interpreter and not to the individual. And so the individual's getting confused. So there's just a link in my head that I made between those two things. And I think it's really important that individuals who may be diagnosed with IDD or some type of disability feel empowered to advocate for themselves and to feel comfortable in their own way to express how they want their healthcare needs met, or how to approach them with their own healthcare needs. And I think that is what Chat is doing there. My next question is really, how can people use Chat? I know that there's a workbook, as you mentioned, Molly, and I know that it was pretty in-depth. It was a couple of pages long. I forget how many pages, but how can people use Chat?
So yeah, I'm really glad you asked that question. I mean, while the tools were developed for definitely people with disabilities, I think they can be used beyond that population with anybody, really, to kind of think through. And even Molly did one recently and learned stuff about herself and doing the exercise. But I think what's really interesting is that you can use it beyond just folks with disabilities, but really targeting that group, because it is a good way, like Molly said, to peel back the layers of the onion and have a conversation with people. And you can break it up into the different sections of the workbook and the person-centered health profile, but it can be used for any kind of healthcare related appointment, whether it be, your general practitioner, the person who you see every year for an annual exam. It can be for an optometrist. It could be for going to an ENT next week. Like, I could fill that out for myself to go get my ears looked at. And then you can also update the person-centered health profile before each visit, which is nice too. It's a PDF file, both of them. We have them on our website, which we could share, I guess, on your podcast site, like wherever you list the recording, to the tools, and they can be downloaded in PDF form or printed, and they can be updated prior to any visit.
Taylor, do you have any thoughts on this?
Yeah. So like a lot of times when I go to my medical appointment, they have a challenging time bringing my chair with me in it. So in order for them to get the accurate weight for me, they have to weigh me in a chair, which is a lot of times it could be hard to get the accurate weight for me in my chair. And then also it's hard to be able to advocate for myself. That is a really big thing for me. Like when I go to the doctor, I like the doctor to talk direct to me and not the person that came with me, my health partner, whoever is with me. I want them to talk directly to me, because again, I'm the one that knows myself better. I like it when they are there to support me, but I want the doctors and the talk directly to me.
All right, thank you, Taylor. So just to summarize, it's really important for you, and this is just an example of a real use of Chat. When you do have a medical appointment, we all have to be weighed in some way. Sometimes we're happy to be weighed to see how much weight we lost, or sometimes we're terrified, like I am, to see how much weight we've actually gained over the past year. But but they have to factor in the use of a chair when they weigh you at the doctor's appointment, but also, and I think this is really hitting home to what chat empowers, is that you don't want the doctors to talk to someone else or to a staff member. You want the doctors to talk directly to you. I just want to make sure that was correct and that we heard that correctly, right?
Yeah, that's
Okay.
correct.
So Molly, I want to get your thoughts on this too. How can people use chat?
We designed chat so that it was very accessible to anybody who wants to take the time and have an interview with someone. And it may take several sessions to complete the workbook with someone, but then all that information is transferred onto a one-page document that can be shared with a healthcare provider. And it's pretty easy. It is a little bit tricky, and we talk pretty honestly about choice. And oftentimes it's our assumption that everybody wants to have a lot of choices because choices are good. But the truth is, if you're not used to making choices, or you haven't made choices about your health care, and I think I can say for most of us, if I were to go to a doctor and get a serious diagnosis, I'd say, I want to talk to somebody else about this first before I make this decision. And so we want to know, who should that person talk to? Who would they like to talk to before making any decisions? Because it's hard to make choices if you don't know what the outcome of the choice is, if it's not an informed choice. So, and then there are many times, we talk to doctors about, rectal dysfunction, or menstruation problems. And some people may be just absolutely embarrassed to have those conversations with their doctor. And so they might prefer that an assistant or a family member say, hey, is it okay to talk to the doctor about, this urinary tract problem that seems to be going on? And they would much prefer to hand that over to somebody else to kind of have that conversation. And that's great. And so what's important to us is that the conversation happens. And then maybe they'll become more comfortable with it at another time. So questions about sexuality or reproduction, those might be things somebody want to have a conversation with without a family member or a paid care attendant there. So the other thing is that we know that people with disabilities experience exponentially higher rates of abuse than typically developing people. And it's important to me that they have an opportunity to see a professional alone, because a doctor who's administering a physical exam might notice signs of that. And it's important that I feel like they're asked those questions without someone else in the room.
Yeah, those are really, from all three of you, really good points. And I think we don't really think about that when we go to a doctor or a medical professional. It's just kind of like just kind of a check on the box sometime. But I think we have to start thinking about that, because communication is key in order to a better quality of life. And you have to be able to feel comfortable where you want to advocate in certain areas, but also in some areas, like between me and my wife, she's the medical person. She starts talking medical stuff, I have no clue. She has to bring it down just a little bit. And so you need that extra person that may be in your life, staff member, family member, whoever, to help interpret the things for you. So I'm glad we kind of did a round robin of that. Now, so I think this next question is for Kayla. Kayla, can you just really describe the case studies and how chat is working? Like, what are we starting to find through its use?
Yeah, like Molly mentioned, unfortunately, when we had funding or more direct funding for this project, we had to pivot and we went to online, and then funding ended shortly after that. And so since then, we've kind of pivoted the training a little bit and have started offering training for disability service providers. So there's been different title iterations, but right now we're calling it person-centered approach toward better health for adults with IDD. And so in offering like between 2 and 3, I think it's 3 now, trainings, we've trained over 380 providers, and that spans the US. And we've actually had a couple people internationally participate, which was kind of cool to see someone from somewhere in England participating in our session. So it's been nice to see willingness from that community, from the provider community, to uptake these tools and learn more about it. Because to me, it signifies that people want folks with IDD to have a voice in their healthcare and have a seat at the table in directing the healthcare that they will get or are getting currently. And so through that too, we wanted to know, because the intention when we developed all of this was to train people with ID, to empower them. So we're like, well, what do the providers think about what we've, the training that we've provided to them? And so we sent a survey out to folks that did complete those couple of trainings I mentioned. And while we trained all these people, only about 10% responded to the survey, which, it's not great, but not horrible either. It's like, we're glad the 10% did respond. And they span different professions. So a lot of behavioral or mental health professionals, case management or support coordination, and then direct support professionals. And of those, 9 people had used the tools, which was really good to hear, like during an actual healthcare appointment. And then 75%, they said they wanted to share it with a healthcare professional in the future. So they hadn't gotten the opportunity to use it yet, but definitely wanted to use it. And then we asked for recommendations from the group too, because we want to know, like, how does this actually work in real time? Because we haven't been able to assess that at all, like to follow up with people that did have chat training in the past. And so some suggestions were to translate the tools in different languages, because right now we only have it in English format. And then also make versions of the tool for low vision users. So for folks who may use screen readers or may need to enhance things really largely to be able to see the text or the font that are on the tools that we've created. And then we also asked folks to how would they describe the tools to someone else? And I thought, we got a lot of good nuggets there from folks, but I think one of them that I think struck us all when we read the evaluations of the survey, someone said it's a simple tool to aid in conversations with individuals with IDD to help them take ownership of their own healthcare. And I think that really speaks back to what we hope to accomplish when we embarked on this way back when. Like when I looked at the date of when we started this project, it's so long ago. I mean, it's almost been 10 years now. It seems like yesterday. And when we sat at the table with that group of professionals and family members and people with ID that Molly mentioned. So it's just been really great to get that information from folks so that we can continue to enhance the tools and share them more widely with other audiences too.
All right, yeah, and I think it's amazing that you reached 380 providers, not just only in the U.S., but a few overseas as well. And just the responses and based on the data that you just mentioned, it sounds like it's really having a very positive impact on the people who are using it. And it is starting to change lives. And it sounds like it is starting to gain momentum as we are coming out of the, I don't know if we're in the pandemic or not. I don't know these days. I honestly don't know. But it is gaining traction. And you guys thought very well in your feet and knew that we're going to have to rely on the use of the internet and things of that nature. So I thought that was a great approach there. So now I guess my next question is, what do you see for the future for chat? Because I think it has a very bright future. I think it's going to be a very useful tool, and it can be very well utilized, not only in other countries, but also in very specific circumstances with other tools as well that are being used across the US. But what do you see for the future?
So I know I'm listed here as like the primary person, but I think it would be good for everybody to kind of chime in if I've missed some things. But I think one of the things that we recognize from the beginning, and what Molly has actually said over and over through the years, is like, we'd like to see, how does this work? Like how, if a person with a disability and their health partner is what we call the folks who attended training with them, completed the training, how are they using it in real time with a physician, with a nurse, with an OBGYN, whomever? How are they actually using it? Does it work the way we anticipated it would? And then also, I think personally, I want to be able to share the tools more widely with across healthcare professions. So we've targeted, like I said, mostly the folks who've come to our trainings have been people interested or related to the disability services field in some way. Not a lot of healthcare providers, definitely not medical physicians or oral health providers have attended. So how do we start to reach out to those fields so that they can know about this tool and give it to folks that may be coming to their practices? And then along with that, I actually emailed a friend who I know who works at a local hospital system specifically with electronic health records. Like, how can we get this in electronic health records? Like, to be a question or a subset of questions, replicate the tool, whatever we need to do to get it integrated to where if someone is a patient of hospital A or doctor's office A, questions can be in there so that whenever your provider, whoever you're seeing, can look at, what's important to you up front. What don't you like to happen in a doctor's office? Who do you want me to speak to prior to you even coming in, so that it's just there and it can be updated constantly virtually instead of, having to take a piece of paper or email a PDF. So that's like an ultimate goal of mine. I don't know how long that would take or how achievable it is, but I'm starting to figure out what we can do to get there.
All right, perfect. And Taylor and Molly, is there anything else you want to add to that? Because it sounds like the team is already thinking about like the next step and things like that. But I want to get your perspective of what you would like to see with chat in the future. Maybe more use, or maybe down this path, or what are your thoughts on that?
I'm just going to add, because, I've spent a lot of time developing the tools and talking to people about them. And Taylor interviewed me to complete a health passport a couple of months ago. And I really learned some things about myself and about what was important to me in a medical visit, that even though I spent so much time developing these tools, never actually stopped to consider myself. And she asked this kind of open-ended questions and kind of led me through some scenarios. And I really learned some things. And so I probably am one of the few people listening to this podcast who remembers when Public Law 94-142, which was the rights of kids with disabilities for an education, when that law was passed. And I remember when special education teachers were talking about IEPs, and they said, once parents of non-disabled kids hear about these individualized education programs, everybody's going to want one. And I feel like once people start using these tools, it's universal design. It's really not just for people with disabilities. Everyone benefits from understanding what their health priorities are, and taking the time to think about how they make their healthcare decisions and what they'd like to see more of, because that really helps you be a better health advocate. And if we all become better health advocates, then we're more likely to set a model for other people, for the people with disabilities in our lives who will model that, hopefully.
And Taylor, as a trainer and an expert in the use of chat, do you want to offer any on what you'd like to see with chat in the future?
Yeah. I just wanted to see that what Taylor said about the technology version of chat. I think that would be really, really cool to see too in the future, because like a lot of times when we go to medical appointments, we might forget to bring like the hard copy. That it would be really cool to have the online version, the technology version where it's already there. But just like chat, I also use it a lot too. Like when I do go to my appointments, because it's really important for them to know like what I need and what I want, and I want to be able to put it out more to other people with disabilities as well.
All right, excellent. So I want to thank you, all three of you, for being part of this podcast, and it's going to reach a lot of people, and I think it's going to affect a number of lives. And we're actually going to put some of the resources about chat in the show notes below so that they can access everything. So I'll just end with this last question. Molly and Kayla and Taylor, if someone wants to reach out to learn more about chat, is there a specific link or possibly email address that they should reach out to?
Yeah, so unfortunately, I don't know the exact the web address off the top of my head, but we do have a website that has the tools living on it. And I believe my information is on the website to contact for chat. And that's only to just alleviate all of the contact that Molly probably gets about another project or several other projects that she works on here at the partnership that people are probably asking her about. So do you want me to give my email address here, or just put it in the underneath, like you said, in the description?
As long as they know it's in the webpage,
Yeah,
and they can go there, then that's fine. If you don't feel comfortable giving out your email on a podcast, that's perfectly fine.
Well, it's also like it's one of those spellings where you're like, G as in girl, like, so I don't know if it translates well over a microphone. But yeah, so folks can definitely contact me, and we're always interested in pushing the envelope, giving this training to whomever would want it, searching for funding again to to revitalize that portion where we're actually training people to use these tools. So if folks hear about us, hear this, and are interested, definitely reach out about that too.
All right, excellent. So I want to thank you all for being part of this podcast, and I hope you have a good day.
Thank you.
Carl, you've been great. Thank you so much.
Thank you.
Hey everyone, this concludes our show. Thank you for stopping by to learn more about Tier 2 supports and taking a deep dive into this topic with me. If you enjoyed the show, learned something, or perhaps feeling generous, please feel free to hit the like and subscribe feature to receive additional information on shows as they come out in the near future. And with that, please remember to be hopeful, bold, and adventurous in all that you do. Take care, everyone. Bye.